In this video, we're going to begin the cardiac cycle. So, two good definitions to know for sure. Systole is the period of heart contraction. Diastole is the period of heart relaxation. So always remember these two terms, pretty easy to remember. When we take blood pressure, we take systolic and diastolic, which is contracting and relaxing periods. So the cardiac cycle, what that is, as a definition, it's all the events associated with blood flow through the heart during one complete heartbeat. And of course the heart beats many times a minute, so we're just looking at one heartbeat cycle in the cardiac cycle. So we'll have an atrial systole and diastole, then we'll have a ventricular systole and diastole in one cardiac cycle. So the atria and ventricles contract and relax independent of each other. The cycle represents a series of pressure and blood volume changes, which we'll see, and of course mechanical events, which means contracting and relaxing, always are going to follow the electrical events, because we need that electrical conduction first before you get the contraction. Step number 1, ventricular filling. This is mid to late diastole of the ventricle. So you can see here blood is flowing into the ventricle. So this is happening on both sides simultaneously. This happens passively. Blood just flows from atrium to ventricle, and 80% of the ventricle's filling is passive. At this time, the atria are depolarizing. That's the P wave in our ECG. That depolarization is going to trigger atrial systole, which means the atria, both of them, contract, systole. So we get the filling first, of passive filling, I should say, and then the atria contract, which pushes the other 20% of blood into the ventricles. So right at the end of atrial systole, which means the atria contracted, even though I'm showing you one side, of course it's happening on both sides, you get this end diastolic volume. So that's the maximum volume in blood in each ventricle. And that's the end of ventricular diastole. So that means these the ventricles are done relaxing. It's the end of diastole, and that's what ends this phase. So you know as soon as we flip the slide to the next slide, they're going to start contracting. So right at the end of step 1, ventricular filling, there's the maximum amount of blood we can have in the ventricles, because they flowed in passively, 80%, and then the atria contract. That's the other 20%. That would be our EDV, end diastolic volume in the ventricles. Depolarization spreads to the ventricles, because remember, they have to depolarize before they contract. So that's the QRS wave. Now we're at the end of step 1 of the cardiac cycle. Step number 2 is an extremely quick step as far as time goes. It's isovolumetric contraction. Iso means the same volume. So the ventricles begin to contract, but the volume in the ventricles of blood remains the same. So let's explain this. Well, the atria are relaxed, and they remain relaxed and in diastole for this whole cycle, so that's fine. The ventricles begin to contract. That's the QRS complex in our ECG. So the ventricles are beginning to contract, so we get some pressure exerted on this blood, and this contraction forces these AV valves, the tricuspid valve on the right and the mitral valve on the left, to slam shut because of the contraction. So pressure is building in these ventricles. Remember, the semilunar valves are closed, the pulmonary valve, in which you can barely see the aortic valve. So during this time, as soon as those AV valves close because of the contraction, now all 4 valves are closed. That means the volume inside these ventricles are not going to change, because, well, there's no way in, there's no way out. All 4 valves are closed. They're forced shut by the ventricles contracting. So for that split second in time, When all valves are closed and the ventricles are contracting, going through their contraction, increasing the pressure inside these ventricles, we call that small moment in time isovolumetric contraction. Of course, the contraction and the pressure inside of these ventricles are going to reach a point where it's going to force these semilunar valves open. That's the pulmonary valve, and that'll be what you can't really see here, the aortic valve. And that, when those semilunar valves are forced open, that's what ends isovolumetric contraction, because it's not the same volume anymore, because blood is being forced out into the large arteries. Which brings us to the third step, the ventricular ejection phase. Just like it sounds, blood is being ejected from the ventricles into the major arteries, the pulmonary trunk, or the aorta. So at that point, we see the pressure in the ventricles is more than the pressure in these large arteries, which is why, with the contraction, the blood is being forced out into the arteries. And step number 4, we have isovolumetric, this time, relaxation. This is an early diastole of the ventricles. So what happens is the ventricles have just contracted, they ejected the blood in the last step, now they relax. So this is after the T wave, the ventricles are relaxed. When the ventricles relax, the pressure drops, and now you get blood backflowing through the pulmonary trunk and through the aorta, which fills up the cusps in the valves, and these valves then close, the semilunar valves. And when the semilunar valves close, now once again all 4 valves are closed, so we have isovolumetric, same volume, but this time the ventricles are relaxed, so this is isovolumetric relaxation. So we have end systolic volume, ESV, that's the blood that's left over in the ventricles after the contraction. And remember, this is just a split-second period when all valves are closed, this isovolumetric relaxation phase. One other important part is that the aortic pressure begins to rise, right, because the valve is closed and you got that backflow of blood that's accumulating on the valve. So when that backflow rebounds off the closed valves, off the cusps of the valves, that causes a dicrotic notch, which is just a temporary rise in pressure in the aorta because of the rebound of the backflowing blood onto the valve. We'll explain that more in a couple minutes. So then the AV valves open because of the low pressure in the ventricles, and blood will start to flow into the ventricles from the atria again, but that's where we started last time. So then after those steps, we're starting another cardiac cycle. The atria and diastole begin to fill, and so on from there. So here's some average time frames. Heart beats about 75 times per minute, so one cardiac cycle, one beat, is less than a second on average. Atrial systole, atrial contraction, just a very small part of that, 0.8, it's 0.1. Ventricular systole, a little longer, has more ejection to take care of. And then the quiescent period is total heart relaxation, which is the rest of the time. So spend some time with this chart on the cardiac cycle, and remember this statement here, that blood flows from high to low pressure, but only if valves are open. Right, so we see 3 different graphs at the same time here. The atrium in purple, right, the ventricle, we're just looking at the left side of the heart, by the way, ventricle in blue, and then the aorta, the vessel, in green here. And we can see these periods of time represented by these kind of beige colored lines right here. They represent the isovolumetric time. So this is isovolumetric contraction right here. This is isovolumetric relaxation in through here when all the valves are closed. And we looked at those during those steps in the cardiac cycle. We mentioned the dicrotic notch when we said The aorta is dropping in pressure, but that rebound of blood backflowing off the valve causes that temporary increase I said we'd get back to later. Well, there it is in the aorta. All right, and here you can see here the ventricles are filling with blood, or so I meant to say starting to increase pressure. When the ventricle contracts, the pressure increases greatly, right? And then the valves will open and the blood gets ejected. Read through these. This is the cardiac cycle, but we're just looking at it from the perspective of three different areas: the atrium, the ventricles, and the aorta. It's a good idea to watch an animation of the cardiac cycle. Here it is here. Once again, you can't click on this because this is a video, but you do have this PowerPoint in iCollege, so you can move to this slide and follow this link for the video.